We are working hard to get more organizations to understand the importance of fentanyl test strips. And yes, we will be distributing those through the community from different organizations. The Virginia Department of Health for our Rappahannock area health district is already providing fentanyl test strips. If that's something you're interested in, you can call or go online, look at their website, and it'll tell you exactly how to get access to those test strips. The Rappahannock Community Services Board, Prevention Division, and Substance Use Treatment Division will be providing fentanyl test strips in the community. We plan to have them at events coming up this summer. And if this is something that you feel would be beneficial to someone, or you would like to know more about how maybe an organization that you represent can provide those, please do not hesitate to reach out to me or anyone here from the CSB. We will be glad to help you.
I can just piggyback a little bit off of what you said about our harm reduction group that we have. Just so everyone knows, this has been going on behind the scenes for 7 months now, Sherry. It's been a while, and it's taken us a while to get to this point, but we've been working really hard on it, and we have a lot of other things that we're working on up and coming. One of the things we want to do is make sure that we're introducing it to the community in the appropriate way. So that's what we're working on. It's definitely in the talks, in the works. I'm not sure if we know exactly when. Sherry, you might be able to answer that a little bit better, but please just know that we are working on it.
Yes, we are, and it is part of the strategy. We're starting with the fentanyl test strips and educating the community about what harm reduction is. This includes the general population in the community and places that may need a little more understanding on the way harm reduction works. Harm reduction strategies have been around forever. Those of us here that remember the Mr. Yuck campaign, we just went through hand washing campaign through the pandemics. So harm reduction campaigns have been around for a long time. And when we're talking about substance use and protecting the community, we need to look at what's specific to that community, what will work for that community. There's no one solution fits all. We know that the fentanyl test strips will benefit our community because we know fentanyl is in our community, and we know we have had a majority of our overdoses related to fentanyl. Okay, thank you for that. Next question. So what strategies do you think are effective in terms of reducing the risk of accidental overdosings or poisonings of children in homes where parents use substances, and what can be done or is being done to urge parents to adopt those strategies? I'm going to turn it to the panel to see if they have any response.
I will say, so a lot of individuals coming in, like was mentioned previously, if they're actively using, they may not be aware that they are using fentanyl. So one of the things that we do is we will do a drug screen, and we let them know this is not a punitive drug screen. This is simply so that we can let them know what they are actually using. I will say many of the individuals that I see, they don't know. They think they're getting like the Percocet 30 milligrams. It is not Percocet 30 milligrams. It is fentanyl. So we make them aware of that. We make sure that they leave with Narcan in their hand. We talk to them about the risks, especially if there is children in the homes. You know, where are they keeping these items? You know, here's the fentanyl test strip showing them how to use that and things like that. But I think the biggest thing with this population is just an awareness.
All the nurses in every county in Planning District 16 have some type of training on Narcan and carry Narcan in the school. So these things are happening out there, so people are more aware. Parenting programs are being more active about talking about substances and the risk of substances in the home, not just opioids, but also things like vaping and marijuana use. Anybody else want to add anything to that from the panel? Okay, thank you. And the next question, I think I kind of just addressed this one. It says, which school districts have nurses that are equipped with Narcan, if any? As of now, we just finally finished training the last of the school nurses in the counties surrounding Fredericksburg. So that would be Caroline, King George, Stafford, Spotsylvania County, Fredericksburg City. So King George County was one of the first schools to embrace our naloxone trainings in the community. They've been doing naloxone trainings for students in the school through the healthcare careers classes and criminal justice classes for 5 years now. So other schools are catching on. What healthier options are there versus experimenting or self-medication? Would anybody on my panel like to address that question?
Well, I can say in our OBOT program, our MAP program that we do, part of the things that we do with the participants is we kind of do like activities groups. So helping them find other ways, to address those triggers or their coping skills. So we have taken on doing things like yoga classes or paint classes. Our goal is to teach them new hobbies that is beneficial to them. Journaling has been a really big thing that we have found a lot of our participants enjoy doing. And then we have found that they also like to share that. So it's great all around. Somebody coming in, that might be a little bit scary for them. But once they get into that group, build that support system, it's invaluable. It's just great.
Thank you for that, Ariana. Anyone else?
I'd like to add to that because we're also building a repertoire of support groups that are non-traditional 12 steps. So we have several through the substance use program at RACSB. We've started to do an in-person for people with co-occurring or mental health diagnosis. And it's a way for them to help build a support network and see how others have, designated and created their recovery plan. We're also implementing something called action planning and prevention for recovery. It helps the person decide what their recovery should look like, identifying their triggers, and then putting action plans into place to get through the triggers rather than to have a setback as a result of the triggers.